is Parkinson's diagnosed and what is a carrier looking for in your ERISA disability case? Have you enrolled in a disability insurance policy or plan through your employer? If so, and you've been diagnosed with Parkinson's, I think you need to understand how a disability insurance carrier plan is going to be looking at your medical records. Now, the first thing let's talk about is how Parkinson's is diagnosed. There's no gold standard test for Parkinson's, and the diagnosis is based on clinical findings on examination. Your doctor is looking on examination for slowness of movement, known as bradykinesia, increase in muscle tone, known as cogwheeling, trembling in your hands or feet at rest, known as a resting tremor. And the disability carrier is going to be looking for those examination findings, but they're also going to be looking for how those symptoms that you're having are impacting your ability to function. So what they're going to be looking for additionally in your medical records is stuff like muscle stiffness, difficulty controlling the movement of your limbs, changes in your speech or swallowing, gait disturbances, changes in cognition, depression and anxiety. Now, once the disability carrier has confirmed the diagnosis, then they're going to be looking at your medical records to determine your physical and cognitive restrictions and limitations, why you can't perform the material and substantial duties of your own occupation. Now, just because you're diagnosed with PD doesn't mean that you're disabled, as that term is defined in your policy or plan. And your physician is going to be asked by them to complete forms called attending physician statement forms. They'll address what you can't do physically or cognitively. But what you'll see is that form doesn't ask the right questions on purpose. So I always supplement the attending physician statement form by Social Security Parkinson's disease forms, because those questionnaires ask the right questions. Now, if your physician refuses to fill it out, it's time to find a new physician, because you can't win your case, either it be a Social Security case or an ERISA disability case, without that evidence. So you need to understand that when the disability carrier is looking at your file, they're looking for the objective basis of the diagnosis, objective basis of the restrictions and limitations, and an indication why it is your symptoms impact your ability to do the material and substantial duties of your occupation, as that term is defined by your policy. If you have any questions about your rights to ERISA disability benefits for Parkinson's disease, call me at 727-894-3188. We're active in the Parkinson's community here in the Tampa Bay area, but I represent folks across the United States who have Parkinson's. Give me a call at 727-894-3188 for a complimentary consultation.